Have you ever walked into a doctor's office feeling dismissed, ignored, or like your concerns were brushed off simply because of your age? As a doctor with over 30 years in the medical field, I'm pulling back the curtain on the shocking assumptions doctors make about older women. Assumptions that could jeopardize your health or even your life. From being labeled just old to having your pain underestimated or your sexual health ignored, these biases are real, pervasive, and dangerous. You need to watch this video until the end because I'm revealing the one red flag phrase doctors use when they've decided not to take you seriously, and knowing it could empower you to demand the care you deserve. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Part 1. They assume you're just old. One of the most insidious and pervasive mindsets in modern medicine is the assumption that an older woman's symptoms can be dismissed with a single, lazy explanation. You're just old. This ageist bias is not just frustrating. It's harmful and, in some cases, life-threatening. The moment a woman over 65 steps into a doctor's office, many healthcare providers seem to view her through a reductive lens, attributing every ache, pain, or concern to the inevitable decline of aging. This isn't just an oversight. It's a systemic failure that leads to neglect, misdiagnosis, and missed opportunities for treatment. Imagine walking into a clinic with a legitimate concern, say, persistent knee pain, overwhelming fatigue, or occasional memory lapses. Before you can even finish describing your symptoms, the doctor's demeanor shifts. They nod knowingly, as if your age explains everything. Knee pain. Must be arthritis. It's common at your age. Fatigue. Well, you're not as young as you used to be. Memory issues? Oh, that's just part of getting older. No need to worry. These responses aren't just dismissive. They're dangerous. They create a culture of neglect where real, treatable conditions are ignored because they're cloaked in the vague excuse of aging. Let me share a story that illustrates this problem vividly. I had a patient named Joan, a vibrant 72-year-old who loved ballroom dancing and volunteering at her local library. She came to her primary care doctor complaining of chest discomfort, nausea, and occasional dizziness. These are classic red flags for cardiac issues, but her doctor brushed them off, suggesting it was likely indigestion caused by something she ate. "Watch your diet, take some antacids, and you'll be fine," he said, sending her home with a pat on the shoulder. Joan, trusting her instincts, wasn't convinced. She sought a second opinion, and thank goodness she did. An EKG revealed she was experiencing small, repeated cardiac events, silent heart attacks that could have escalated into a fatal episode. Had she accepted that initial dismissal, her story might have ended in tragedy. This isn't an isolated incident. I've seen countless older women, sharp, active, and full of life, have their concerns minimized or ignored because of their age. The assumption that symptoms are just part of getting old is not only ageist but also medically reckless. Age is a factor, not a diagnosis. Fatigue could signal heart failure, anemia, or thyroid dysfunction. Memory lapses might point to a vitamin B12 deficiency, medication side effects, or early-stage dementia. Joint pain could indicate an autoimmune condition like rheumatoid arthritis or even a treatable infection. Yet, far too often, doctors fail to investigate these possibilities, opting instead for a one-size-fits-all explanation that does nothing to address the root cause. This mindset has real consequences. When symptoms are dismissed, conditions worsen, sometimes irreparably. A missed diagnosis of heart disease can lead to a heart attack. Undetected cancer can progress to an untreatable stage. Chronic pain, left unaddressed, can erode quality of life, leading to depression, isolation, and loss of independence. What's worse, this dismissive attitude often comes with an unspoken subtext. You've lived a long life, so why complain? This is an outrage. Your health, your comfort, and your ability to live fully matter at every age. If a doctor treats your symptoms with less urgency than they would a younger patient's, that's not just poor care, it's discrimination. You deserve a healthcare provider who listens, investigates, and takes your concerns seriously. If you're not getting that, it's time to find someone who will. Because your symptoms are not just old age, They're real, they're valid, and they deserve to be explored. Part 2. They think you're not tech-savvy, so they don't explain. Another deeply ingrained stereotype in medicine is the assumption that older women are inherently incapable of understanding technology or complex medical information. This bias leads to a troubling pattern. Doctors often withhold detailed explanations, simplify treatment plans to the point of uselessness, or exclude older patients from their own healthcare decisions. The result? You're left confused, disempowered, and potentially at risk of mismanaging your health. Picture this. You ask your doctor about a new medication they've prescribed. Instead of explaining its purpose, mechanism, or potential side effects, they wave you off with a vague, "It's just for your blood pressure, take it twice a day." No discussion of how it might interact with other medications, no mention of what to watch for, no effort to ensure you understand why it's necessary. Would they be this dismissive with a 35-year-old patient? Unlikely. The assumption seems to be that if you're over 65, you're technologically illiterate, incapable of navigating a patient portal, and too overwhelmed to grasp a treatment plan. So, instead of empowering you with knowledge, they strip away your agency, making decisions for you and sending you home with incomplete instructions. I've witnessed this countless times, and it's infuriating. I know older women who are tech-savvy, managing their finances online, booking travel through apps, and researching their conditions with a diligence that puts younger patients to shame. Yet, doctors often assume you don't own a smartphone, can't access an online health portal, or won't understand terms like beta blocker or electrolyte imbalance. As a result, they skip the details, rush through appointments, and fail to provide follow-up resources. You're handed a prescription and a pat on the back, left to piece together the rest on your own. This lack of communication has serious consequences. Without clear explanations, you might not know how to take your medication correctly. Missed doses, incorrect timing, or unaddressed side effects can lead to complications. If you experience a side effect, like dizziness or nausea, you might not know whether it's normal or a sign to call your doctor. Worse, when things go wrong, some doctors dare to blame you, claiming you weren't compliant or didn't follow instructions. But the truth is, they failed you by not respecting your intelligence and capacity to understand your care. Let me tell you about Margaret, a 68-year-old retired teacher who was prescribed a new medication for her diabetes. She asked her doctor what it was, how it worked, and whether it would affect her other medications. Instead of answering, he chuckled and said, "Don't worry about the details, just take it with breakfast and dinner." Margaret, a woman who had spent decades managing classrooms and mastering new teaching technologies, was insulted but too polite to push back. She went home, unsure of what she was taking or why. A week later, she experienced severe nausea and nearly fainted. When she called the office, the nurse scolded her for not reporting the symptoms sooner. But how could she? No one had told her what to expect. This pattern of underestimating older women's capabilities is not just patronizing, it's a barrier to quality care. You have the right to understand your health, your treatments, and your options. Medical information should never be gate-kept or dumbed down to the point of being useless. If your doctor rushes through explanations, skips over details, or treats you like you can't handle the truth, don't stay silent. Demand clarity. Say, "I want to understand this fully. Please explain what this medication does, why I need it, and what I should watch for." If they can't or won't meet that standard, find a provider who will. You're not just capable, you're entitled to be an active participant in your healthcare. Part 3. They underestimate your pain. Perhaps the most egregious issue older women face in healthcare is the persistent dismissal of their pain. Medicine has a long, shameful history of downplaying women's pain, rooted in outdated notions that women are overly emotional, prone to exaggeration, or simply too sensitive. For older women, this bias is amplified by ageist assumptions that pain is an inevitable part of aging, something to be endured rather than treated. The result is a dangerous cycle where real, debilitating pain is ignored, leaving women to suffer unnecessarily. I've seen women in their 70s and 80s describe severe, life-altering pain that keeps them from sleeping, walking, or enjoying their daily activities, only to be met with a cursory glance and a dismissive, "Let's monitor it." In medical speak, that often translates to, "I don't believe it's serious," or worse, "You're too old for us to bother fixing it." This attitude is not just unacceptable, it's a betrayal of the trust patients place in their doctors. Pain is not a character flaw, nor is it an inevitable consequence of aging. Yet, time and again, older women are told to tough it out, or that their discomfort is normal for their age. Consider Rita, a 76-year-old woman who was still active, tending her garden and walking her dog daily. When she began experiencing sharp pain in her hips and pelvis, she reported it to her doctor. Without ordering tests or imaging, he told her, "It's probably arthritis. Most people your age have it." No further questions, no referral to a specialist, no plan to address her pain. Rita trusted his judgment and tried to push through, but the pain worsened, making it difficult to walk. 3 months later, desperate for answers, she sought a second opinion. "I ordered an X-ray and MRI, which revealed a fractured pelvis, a serious injury that had worsened because she'd been walking on it. That pain wasn't just arthritis. It was a treatable condition that was ignored because of her age." Rita's story is far from unique. Another patient, Ellen, a 71-year-old grandmother, spent months complaining of persistent abdominal pain. Her doctor repeatedly chalked it up to constipation, prescribing laxatives without ordering diagnostic tests. When Ellen finally saw a specialist, a CT scan revealed advanced ovarian cancer. The delay in diagnosis cost her critical time, and while we'll never know if earlier detection could have changed her outcome, the dismissal of her pain had devastating consequences. Pain in older women is often more complex, as it can stem from a variety of causes: chronic conditions, injuries, or even undiagnosed diseases. But complexity doesn't mean it's less valid or less deserving of attention. If anything, it demands more thorough investigation. When a doctor fails to ask follow-up questions, order tests, or propose a treatment plan, they're not just dismissing your pain, they're dismissing your right to a dignified, healthy life. You know your body better than anyone. If something feels wrong, if your pain is disrupting your life, it's not just aging. It's a signal that something needs attention. If your doctor doesn't take your pain seriously, don't accept it. Ask for specific tests, request a referral to a specialist, or seek a second opinion. Your age and gender should never be an excuse for your suffering to be ignored. You deserve a healthcare provider who listens, believes you, and acts. Because your pain is real, and so is your right to relief. Part 4. They assume you're not sexually active, so they skip important screenings. This issue is one that often catches patients off guard, and it can evoke a range of emotions: shock, frustration, or even anger. It's an uncomfortable truth that needs to be addressed head-on. Many healthcare providers, particularly male doctors, operate under the outdated and entirely false assumption that women over 60 are no longer sexually active. They seem to believe that once a woman reaches a certain age or passes menopause, her sex life simply ceases to exist. This stereotype isn't just wrong, it's harmful. It leads doctors to stop asking critical questions, neglect routine screenings, and overlook treatments that could significantly improve a woman's health, comfort, and quality of life. The reality is far more vibrant and varied than this narrow assumption allows. Older women are not a monolith. Many remain sexually active well into their 60s, 70s, and beyond. Some are in long-term marriages, nurturing intimate relationships built on decades of connection. Others are re-entering the dating world after divorce or the loss of a partner, rediscovering romance and intimacy with excitement and curiosity. Some women are even exploring their sexuality in new ways, perhaps for the first time, as societal stigmas loosen and they feel empowered to prioritize their desires. Yet, too many doctors fail to acknowledge this reality. Instead, they act as if sexual health becomes irrelevant after a certain age, dismissing concerns that are deeply tied to a woman's physical and emotional well-being. This assumption has serious consequences. When doctors assume older women are not sexually active, they often skip essential screenings and conversations. They may not test for sexually transmitted infections, STIs, even though rates of STIs like chlamydia and gonorrhea are rising among older adults due to increased dating and less consistent use of protection. They may fail to ask about discomfort or pain during intimacy, which could signal treatable conditions like vaginal dryness, atrophy, or infections. Pelvic exams, which can detect early signs of gynecological issues, are often deemed unnecessary. Discussions about hormonal changes, lubricants, or therapies that could restore comfort and pleasure are brushed aside as irrelevant or too awkward to address. This silence leaves women vulnerable, their concerns invalidated, and their health at risk. Consider the case of Celia, a 68-year-old widow who came to me for a second opinion. After years of being single, she had started a new relationship that brought joy and vitality back into her life. She was thrilled but also nervous about navigating intimacy after so long. A few months into the relationship, she began experiencing pain and occasional bleeding during intercourse. When she raised this with her primary care doctor, he dismissed it with a wave of his hand, saying, "That's just part of aging, nothing to worry about." He didn't perform a pelvic exam, didn't order tests, and didn't ask about her sexual history. Celia felt embarrassed and brushed it off, so she delayed seeking further care. By the time she came to me 6 months later, she was in significant distress. After a thorough evaluation, I diagnosed untreated infections, severe vaginal atrophy, and early signs of tissue breakdown, conditions that could have been managed or prevented with timely intervention. With proper treatment, including localized estrogen therapy and antibiotics, Celia's symptoms improved dramatically, and she regained her confidence and comfort. Her story is a stark reminder of what happens when doctors fail to see older women as sexual beings with valid needs. This issue isn't just medical, it's deeply cultural. Society often expects older women to fade into the background, to become invisible as sexual or even desirable individuals. Media portrayals rarely depict women over 60 as vibrant, sensual, or romantically engaged, reinforcing the myth that aging women no longer have, or want, intimate lives. Doctors, shaped by these cultural biases, may feel uncomfortable discussing sexual health with older patients or assume it's a low priority. But your needs, your body, and your right to pleasure don't vanish with age. You deserve a healthcare provider who respects your full humanity, who asks questions without judgment, and who offers the screenings and treatments necessary to keep you healthy and comfortable. Here's my advice. If your doctor doesn't initiate a conversation about your sexual health, take the lead. Be direct about your concerns, whether it's discomfort, changes in libido, or questions about safe sex. If they seem dismissive, uncomfortable, or unwilling to engage, that's a red flag. Seek out a provider, perhaps a gynecologist or a women's health specialist, who understands that sexual health remains relevant at every age. You have the right to comprehensive, respectful, and age-inclusive care. Never let anyone make you feel ashamed for wanting to live fully, love deeply, or prioritize your physical and emotional well-being. Part 5. They assume you're not worth the aggressive treatment. This topic is one of the most challenging to discuss because it sits at the painful intersection of ageism and medical ethics. Time and again, I've witnessed older women, often in their 70s or 80s, present with serious health conditions like cancer, heart disease, lung issues, or kidney problems, only to be met with a subtle but devastating bias. When treatment options are discussed, doctors may present surgery, cutting-edge medications, or intensive therapies but then qualify them with phrases like, "At your age, we don't typically recommend that," or "the risks might outweigh the benefits at this stage," or most dishearteningly, "let's focus on keeping you comfortable." In some cases, these recommendations are medically appropriate. Less invasive approaches can indeed be the best choice for certain patients. But far too often, these suggestions stem from an unspoken assumption that aggressive treatment isn't worth pursuing for older women, as if their remaining years are less valuable or their capacity to endure treatment is inherently limited. This bias often manifests before the patient even has a chance to weigh in. Doctors may assume that an older woman wouldn't want to undergo surgery, tolerate chemotherapy side effects, or commit to a complex treatment plan. They may believe her quality of life isn't worth the financial or medical resources required, or that her time is too limited to justify the effort. Worst of all, these decisions are often made without fully involving the patient in the conversation. The result? Women are robbed of agency, denied the opportunity to explore all their options, and left with treatments, or lack thereof, that don't align with their goals or values. Let me share the story of Margaret, a 74-year-old patient diagnosed with early-stage breast cancer. Her initial doctor recommended only hormone therapy, framing it as the simplest option. He didn't discuss surgery, didn't refer her to an oncologist, and didn't ask about her priorities. When Margaret's daughter pressed for more details, the doctor admitted he chose the conservative approach because she's not young, and we want to avoid unnecessary stress. But Margaret was anything but frail. She had run her accounting firm for 40 years, walked 3 miles daily, and was planning a trip to Italy. She wasn't ready to settle for simple. After seeking a second opinion, She was referred to an oncologist who laid out all her options, including a lumpectomy and radiation. Margaret chose surgery, recovered smoothly, and 4 years later, she's cancer-free, traveling, and living life on her terms. Her outcome could have been very different if she hadn't advocated for herself and sought a doctor who saw her as an individual, not an age. This issue reflects a broader systemic problem. Ageism in medicine often leads to undertreatment, where older patients are offered fewer options than younger ones with similar conditions. Studies show that older women with breast cancer, for example, are less likely to be offered reconstructive surgery or aggressive chemotherapy, even when they're otherwise healthy. The assumption that older patients are too fragile or that their lives are less worth fighting for is not only discriminatory, it's a betrayal of medical ethics. Every patient deserves to know the full range of treatment options, their risks, and their potential benefits. You deserve to decide whether you want to pursue aggressive treatment to extend your life, improve your quality of life, or simply gain more time with loved ones. Here's what I tell my patients. Your life has value, no matter your age. You are not a burden on the healthcare system, and your goals matter. If a doctor seems to be steering you toward less aggressive care without a clear, evidence-based reason, ask questions. Request a referral to a specialist. Seek a second opinion. Insist on a detailed discussion of all your options, including the risks and benefits. If you feel dismissed or unheard, find a provider who respects your autonomy and treats you as a partner in your care. Ageism has no place in medicine, and you have every right to fight for the treatment that aligns with your vision for your life. Part 6. They think you're set in your ways. This final point is more subtle but no less damaging. Many doctors, whether consciously or not, assume that older women are rigid, unwilling, or incapable of making meaningful lifestyle changes. They believe that by the time you reach your 60s, 70s, or beyond, your habits, how you eat, exercise, sleep, or manage stress, are so deeply ingrained that suggesting new approaches is pointless. As a result, they skip critical conversations about lifestyle interventions that could transform your health and well-being. They don't discuss strength training, despite its proven benefits for maintaining muscle mass, bone density, and mobility. They don't explore dietary changes, even when you're struggling with low energy, weight fluctuations, or chronic conditions like diabetes or hypertension. They don't suggest strategies for improving sleep, boosting cognitive health, or managing inflammation and mood. Why? Because they've already decided you're set in your ways and won't follow through. This assumption is not only short-sighted, it's lazy and patronizing. It denies older women the opportunity to grow, adapt, and thrive. I've seen countless women in their 70s and 80s defy this stereotype with remarkable resilience and motivation. One patient, Ellen, an 82-year-old retiree, came to me feeling frustrated by her declining energy and balance. Her previous doctor had prescribed medication for her joint pain but never discussed exercise or nutrition, assuming she wouldn't be interested. After a thorough assessment, I recommended a gentle strength training program tailored to her abilities. Ellen embraced it, starting with light resistance bands and progressing to bodyweight exercises. Within 6 months, her balance had improved, her joint pain had decreased, and she was walking her dog farther than she had in years. Another patient, a 76-year-old named Linda, reversed her prediabetes by cutting back on processed sugars and adding more whole foods to her diet. Changes her doctor never suggested because he assumed she wouldn't alter her eating habits. These women, and countless others like them, prove that age does not dictate your capacity for change. Older women are often more motivated than younger patients because they've lived long enough to understand the value of health and independence. They've raised families, built careers, weathered losses, and reinvented themselves through countless life transitions. To assume they're incapable of adopting new habits is to underestimate their strength, resourcefulness, and adaptability. This bias also reflects a broader pattern in healthcare. Younger patients often receive detailed lifestyle counseling, while older patients are rushed through appointments with a quick prescription and minimal guidance. A doctor might spend 20 minutes discussing diet and exercise with a 40-year-old but offer an 80-year-old woman a 5-minute consultation and a pill, assuming she's too set in her ways to bother with anything else. This isn't just unfair, it's a form of quiet discrimination that limits your potential to heal, grow, and live better. Here's the truth. You are not stuck. You've already proven your resilience by navigating decades of challenges and changes. If given the right tools, support, and encouragement, you can make meaningful improvements to your health at any age. Whether it's starting a walking routine, trying mindfulness to reduce stress, or tweaking your diet to boost energy, you can evolve. If your doctor doesn't believe in your potential or fails to offer practical, evidence-based suggestions, they're not doing their job. Seek out a provider who sees your strength, respects your ability to change, and partners with you to create a plan that fits your life. You deserve care that honors your resilience and empowers you to keep growing, no matter your age. That's it, ladies. The truth about how older women are too often misunderstood, dismissed, or underestimated in the medical world. I hope this has opened your eyes to the biases you might face and empowered you to advocate for the care you deserve. What have you learned from this video? What's one thing you're taking away that you'll put into practice in your life? Please share it in the comments below. I want to hear your thoughts and stories. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more insights to help you live fully at any age.